Hi, I'm Dr. Kelly Starrett with the Ready State. One of the aspects of training and working with teams that sort of is underrated is how busy coaching staff, rehab staff, and athletes actually are. And one of the things that we try to do when we come into these high-performance environments is ask, where do we have downtime? Where are we having windows where we can take advantage of care, of recovery, of adaptation for the athlete while they're doing something else, while she's engaged in some other activity? And it turns out there are these kind of flat spots or hidden spots that are very effective. And one of them is meetings, one of them is travel on the bus, one of them is plane flights, even overnight in sort of the hotel room. And what's nice about using H-Wave in these situations is that our athletes are already comfortable. The device has been integrated into their sort of acute trauma stages, when they've got hot spots and they've had surgery, so they understand it. They know how to use it in low frequency in terms of managing congestion and sort of overuse. But in this situation, we're able to apply the H-Wave to these sort of hidden moments of adaptation potential, which allows us to get a lot of more recovery in and decongestion sort of an adaptation in while our athletes are doing something else. So in the NFL, there are lots of meetings that athletes have to attend and lots of film sessions. We found that that's a really useful time. A lot of our sort of teams and colleges have to spend a lot of time on buses. Turns out that application of H-Wave during those times is very, very effective. And athletes who've just competed now, instead of sitting there and becoming stagnant, are able to decongest massively just while they're in transit. And of course, we love for our athletes to take care of their bodies while they're asleep. It's a great time to enhance recovery because nothing else is going on. And more importantly, this helps sort of unburden the rehab staff. This helps to unburden the performance staff. And this also gets sort of the athletes not having to do one more thing. That these are down times where the athlete can take care of herself in the background. And ultimately, that's what we're trying to do, is trying to get the most out of the athlete, have the athlete be the freshest and feel the best, that she can compete at the highest levels or play at the highest levels or do their work at the highest levels while they're not having to think about sort of being active or sort of actively recover. So again, how can we think about integrating proven recovery techniques into their lives, into the daily schedules of our athletes? Try looking at where someone is having some flat spots and see if you can't increase their recovery time while they're doing something else.